Welcome back to the Popped Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we're going to start with another Popped quiz. This time, I want you to answer each statement with whether you think it's common for pregnancy or normal for pregnancy. Normal meaning it's expected, it's supposed to happen during pregnancy. Common meaning it's not supposed to happen, but a lot of people experience it anyways during pregnancy. So number one, we have you feel sharp shooting pain in the front of your pelvis when rolling over in bed. Is this normal or is it just common? It's common, but it's not normal. We'll go through some of these more in depth throughout this full episode. Number two, you need to pee more often, especially as baby grows. Normal or common? This one's normal. Baby's growing right on top of your bladder and putting pressure directly onto the bladder. So it makes sense that there's going to be more pressure down there that you would need to pee more frequently. Number three, you hear or feel clicking in the front of your pelvis when you walk. Is that normal or common? It's common, but it's not normal. You should not feel popping or hear clicking when you walk at the front of your pelvis. Number four, you wake up with pain on the outside of your hips after sleeping on your side, either side. Is that normal or common? That is normal. That one, I hate to say is normal because I know a ton of people experience it and they're hoping that I can do something about that issue with sleeping. But unfortunately, because of the amount of relaxin that sits in your body, it kind of works like an epidural. Like if you were stuck on one side for a long time, the epidural would only be numbing that one side of your body. Kind of the same when you're laying on one side, relaxin starts to sit on that one side of the body, and as all the pressure from your body is pushing down into that now really loose side of your body, it's going to put a lot of pressure into those joints and into the ligaments, stretching it out, making it feel sore or overstretched. Number five, your pelvis feels like it's being pulled apart when going upstairs or putting on pants. Is that normal? Is it common? This one is common, but not normal. You should not feel like your pelvis is ripping apart when you put on your pants or when you go up the stairs. Number six, you notice a subtle waddle developing in your third trimester. Is this normal or common? We've talked about this one before. This one is not super normal, but it's very, very, very common. It's normal because, and again, I'll talk about this later, it's normal because psoas are always going to get tight, and if you don't get care, yes, you're going to have a waddle, and yes, it's going to put more pressure onto that pubic bone. For the sake of this episode, this is not really normal. It can be somewhat expected depending on other things that happen in the body, and that's what we'll talk about later. But waddles, for the most part, aren't really normal. You can have a shift in your gait, but a full waddle walking isn't super normal. Number seven, you get sciatic type pain shooting down from the back of your leg, sometimes past the knee. Is that normal? Common? This one is very common, not normal. Your pelvis should feel unstable. We'll talk about different ways to get in and out of the car, but this typically tells us that we might have some SPD or symphysis pubis dysfunction. Number nine, your pubic area is in pain after a long walk or standing for too long. Is this normal, common? This one's common, but not normal. It's somewhat normal to have a little tenderness or a little soreness at different points of your pregnancy in that pubic area, but it's not normal to have pain or lingering aching discomfort in that pubic symphysis area, that pubic bone area. Last one, your abs begin to separate and you start feeling more pressure on the pubic bone region. Is this common, normal? This one is normal, and it's really common. A lot of people experience this, and we're expected to experience it. Because your abs are supposed to support your low back on the front of your spine, when they actually separate, there's no support for the front of your low back. So the muscles on the back side of your low back start to stabilize that low back. Well, now that those muscles are supporting your low back and trying to help them not move, they're not as helpful in supporting your lower half of your body up off of your hips up against gravity. So then baby's weight and baby's gravitational force is actually leaning more onto that pubic bone area. It's going to put more pressure onto that area. So it's pretty normal to experience more discomfort in that pubic bone area as your abs start to separate. Eventually, you build a little bit of tolerance, but it's also helpful to make sure that you have other muscle support in other parts of your body to help support baby up off of that pubic bone so you're not in pain, because pain, like we just said, is not normal. It's very common, but it's not normal. So if you were confused on any of these questions, or you're experiencing some of the symptoms in these questions and you're like, oh gosh, why am I not normal? Why am I with the common people? I want to be, normal, or not in just some of these common ailments that we see during pregnancy or postpartum. These weren't meant to point out any particular issues or problems in your pregnancy, but maybe highlight some areas where we think things are normal, but actually they're not normal, and we can do something about them to enlighten or, improve our pregnancy and birth and labor experience. So we're going to dive really deep into the pubic symphysis, the two pubic bones in the front of your body that meet together with some cartilage in between, called your pubic symphysis. You will often hear it termed as SPD, or symphysis pubis dysfunction. We will probably call it SPD for the remainder of this episode. I really want to dive into the deep nitty-gritty of the pubic bone and all of its inner workings so that you can understand why this happens and how to be aware of it, how to take care of it, and not just go on suffering throughout pregnancy if this is something that you're experiencing, or if you know somebody else that is experiencing this. I don't know why I'm putting that over there. We're going to use this. So your pubic symphysis, I just said, we have your two hip bones meet together in the front and in the back. And in the front of the body, they meet together with some fibrocartilage in the middle. So a lot of times we say we have one pubic bone. You actually have two pubic bones that come together by cartilage. This is your pubic symphysis. The cartilage that is holding this together, we have different types of cartilage in our body. This cartilage is fibrocartilage. It is the toughest cartilage in the entire body. And by tough, I mean, if you think about the skin on the bottom of your feet versus the skin under your chin, the skin on the bottom of your feet is much tougher than the skin under your chin. The cartilage right here is the toughest cartilage in the body. So this is really thick, tough cartilage. It's really hard to move, maneuver, stretch, do anything. That's why it is in the central part of our walking, so that we don't have a ton of discombobulation with our hips when we go to walk. Because it's the toughest cartilage in the entire body, its nickname is Tough Mother, which I think is super interesting. Tough Mother. It has to actually stretch and make space for baby to come down the birth canal. So pubic symphysis, or SPD, symphysis pubis dysfunction, refers to pain, inflammation, or excessive movement at the pubic symphysis. It's designed to allow very small amount of movement, just enough to help stabilize the pelvis and accommodate for childbirth. During pregnancy, the body begins to prepare for labor early on by processing all those hormones that we've talked about before, our relaxin, our progesterone. These are going to soften and loosen all of our connective tissues within the body, throughout the body, on the body. These changes affect the entire pelvic girdle, not just the backside, but also the front side where that pubic symphysis meets. And again, because the changes affect the entire pelvic girdle, with the pubic symphysis being the central man, or the central foundation of movement throughout the body, this is where we have a lot of vulnerability for discomfort when there's excess motion or mobility pulling or stretching on the joint or tissue. So it's kind of hard to see if you're listening on Spotify or Apple Podcasts. This is a really good episode to watch on YouTube, just because I'm going to be using the pelvis to demonstrate some motions and some movements with this pubic bone. If you can see these two holes, these are where your femur heads actually go into your pelvis. So we think about our pelvis being like this, but actually, sorry, I'm going to face it this way. Think about our pelvis being like this. This is the front, this is the back. This is not actually how we sit, though. The way that my pelvis sits on this little stand is not how we actually sit. These two bones right here are actually your sits bones. So they are going to be more tilted. When you sit down and feel under your sits bones, this is what you're feeling. These ischial spines, these ischial tuberosities. So when we have those femur heads coming out the front, all of that motion, all of that walking is landing right here, the apex of that pubic girdle, or that pubic bone, or pelvic girdle. So imagine I have my two femurs right here. As we move, you can see how the motion is pushing in and around that pubic symphysis. I'm exaggerating it quite a bit. Like I said, there's not a ton of motion here to begin with, but I want you to see where that motion is elicited from movement in the legs. It's going to happen right at that pubic bone, right around that cartilage. SPD is not just about hormones. It really is the combination of hormonal softening, altered posture, gait mechanics, and muscle imbalances that causes stress on cartilage-based joint. So moving on, we have the biomechanics that contribute to SPD. As baby grows, the weight distribution shifts and the pelvis begins to tilt anteriorly. Think your belly moving forward. We already sit, like I just said, like this. As baby grows and as those abs separate, we lose support in our low back. So the hips are going to continue to tilt this way, which of course we have baby growing right here. There's going to be a lot more pressure put down onto this pubic bone and the pubic symphysis. Now, as this weight load shifts, depending on where baby is carrying or where mom is carrying baby, not always just boy babies. It totally depends on who you are, what kind of body type you have. Every mom carries differently. But if you happen to be carrying very low, we're going to start to accommodate for that space for baby by separating those hips in the back and creating a wider leg stance. This wider leg stance can sometimes cause mom to waddle. That's why I said for this episode, it can be somewhat normal depending on how you look at it, but a lot of times it just takes mom a couple of days, about a week, to accommodate to that shift in the space, for the space that baby needs in their pelvis, and their walk should become more like that figure eight motion, both hips moving at the same time and not just side to side waddle. Now, if one leg or one hip moves in a much more aggressive direction pattern with some pressure, that can cause some shearing and joint shifting where it feels like there's a lot of stretching or shearing of your joints. It doesn't necessarily mean that your bones got closer together and it's bone on bone, but because that fibrocartilage is so tough, that's what it feels like when there's too much stretch on it. And then there's an oppositional pull in direction, whether you're picking up your leg, putting down a leg, sitting down, standing up with one leg, or putting too much pressure into one side, one hip joint. That's why I get kind of frustrated when SPD is just brushed off as normal pregnancy pain, because this is not normal. It's dangerous, and women need access to stairs. How many of you guys live in a house or requires stairs to get to your place of living? Most people, it requires a big motion of their hips just to get into bed or onto their couch. So this isn't just like normal pregnancy pain. This is really some safety hazards that we're dealing with for sometimes 10 or 12 weeks during a mom's pregnancy. Just because something is common does not mean that it's normal. That's what I was trying to get at with the popped quiz today. Just because these things are common doesn't mean it's normal. Doesn't mean you have to suffer with this pain or this discomfort. We think a lot of things are just normal with pregnancy because your body's growing a baby and it's getting bigger, and yeah, there should be some pain with it. That's not the truth. You really shouldn't have to feel pain or discomfort throughout your pregnancy. Some of this stuff is not normal. I am here to validate you. This is not normal pregnancy pain. If you're experiencing SPD, go see somebody. If somebody is not listening, go see somebody else. Come see me. I will always listen. You can always message me if you can't find anybody who is listening to you. So, pubic symphysis. As I was writing this episode, I was thinking, I wonder how much my pubic symphysis moves since I'm not pregnant. And upon some research, our pubic symphysis do move. Non-pregnant people, we have very, 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 very little movement. It's about 1 to 2 millimeters of movement in our pubic symphysis joint. And some sources say it can get up to 3 millimeters. That's more on the high side, probably more for our very low tone, flexible, very lax people. But this tiny amount of movement, the 1 to 2 millimeters of motion in the joint, actually is for shock absorption. Every time that you walk or step, put some pressure up into your body. This is to allow your pelvis to absorb some of the shock evenly and distribute it back up through your spine, through your head. This is how we actually access the floor, know that we're walking, and we're able to continue taking more steps. And then it also allows for some load transfer when we're actually putting weight and pressure into different sides. Like imagine carrying a big box upstairs. You would need to be able to make some motion, put the stress into that joint, and then use that joint to lift up on to take another step up the stairs. When we're pregnant, your body is under the influence of relaxin, progesterone, and estrogen, all of those relaxing hormones. So this is going to allow all of the connective tissue, all the soft tissues in your body to soften, including the pubic symphysis. This pubic symphysis is going to widen and become more mobile, usually about 4 to 5 millimeters of motion. That's about a half a centimeter. That is normal physiological adaptation during pregnancy for the pubic symphysis. This widening is considered normal and healthy when it happens gradually. Sometimes it happens really quickly. If you do a big stretch, if you do a big movement, and you happen to be on a week where there's a high pump of relaxin coming through your body and it just stretches too much, it can cause some damage and create a lot of pain. If you're second, third, fourth, fifth, whatever time mom after your first, and your body already knows how to create space there, sometimes it can create that space a little too quickly, and you can feel discomfort or pain in that area for a couple weeks. Usually your body will overcome it and find its tolerance, but when it happens quickly, the body is not used to that much space in our pubic symphysis or that pubic bone area, and it can create some discomfort for you as well. In SPD, the movement exceeds what is physiologically adaptive. So this is typically 9 to 10 centimeters of motion. This is where instability, shearing, or pain starts, indicating dysfunction, not just adaptation. So why does SPD hurt if it's just more mobile? That was my big question. SPD just means more motion in the pubic symphysis. Why is there actual pain? Don't we want more motion? Isn't that what we want? Well, yes, we want more motion, but it's not just the increased movement, it's the actual motion of the other segments of the body, other parts of the body that start to create this inflammation process, this pain process in and around the central area where a lot of things connect, right by that pubic bone. I have a couple reasons of why we feel pain with SPD, because I like reasons. I like to understand why. Here's some of our better understandings. We have 1, microtrauma to the cartilage and joint space. The pubic symphysis is normally 2 to 3 millimeters of movement. In SPD, it can move up to 9 millimeters or more. This abnormal movement strains the fibrocartilage and the surrounding joint capsule, creating more micro tears and or inflammation. So if you think about a rubber band and you stretch it over and over and over and over and over, just keep stretching it a lot of times, some of those fibers, maybe not even over and over, if you just stretch it one time really, really, really hard, those fibers on the outside of the rubber band, you can start to see them peel away. Those are like micro traumas or micro tears in the tissue. And when we do that overstretching pattern, those fibers eventually become really irritated. They become re-injured. They start calling in more inflammation. They're telling the body we're injured down here, and the body keeps thinking that your pubic bone is injured. That's why it starts sending pain signals down there, so that your body starts sending healing signals or healing mechanisms to start helping that area. Then we have muscle guarding and compensation. The body senses instability at the pubic symphysis. It tightens nearby muscles to stabilize the area, starting with our adductors, all the muscles that line the inside of your inner thighs. Then we have our lower abdominals. Lower tummy starts to get tight. And then we have pelvic floor muscles, clenching your butt cheeks or your pelvic floor. It's going to start creating a lot of intrauterine constriction all the way back to episode 1, and it could cause your baby to flip. I'm not saying that this is what causes babies to flip by any means. This is not what I'm saying. But I'm saying this is something that leads to intrauterine constriction. It leads to over tightness or overtoned pelvic floors, and it keeps baby inside or keeps baby from coming out simply, successfully, naturally, whatever it is that we are trying to do with baby for our delivery. So we really want to make sure that we're not overexciting, overstimulating, over contracting, activating muscles that need to be in an open state to create more space for baby. This can cause more muscle spasms, trigger points, and deep aches. A lot of times it creates a deep ache right in that birth canal. Deep ache in the birth canal creates a lot of discomfort, frustration, fear from pushing anything through that birth canal. We want to make sure that our muscles are taking the stress of the structure, not creating more stress on your structures because of pain from incorrect imbalances in your structures. Then we have shearing and uneven load transfer. The pubic symphysis is a load sharing joint, meaning that the weight and the movement from the legs, hips, and core all pass through it. Like I said earlier, we have our hips on the side. All of our motion is going to happen through this pubic symphysis every time that we walk, stand, move, load, weight, do anything. When it becomes unstable, normal daily activities like walking, standing, lifting one leg can cause left and right pubic bones to grind or shear against each other. It doesn't mean that these bones are coming closer together and grinding bone on bone or like overlapping or something. That is not what is happening. It means because, like I said, this cartilage is so tough when there's already stretch on the pubic bone and you go and do these motions and we have too much stretch on the pubic bones, it feels like something is pulling bone on bone right at your pubic bone. This type of movement starts to create a pinching or a pulling sensation described by many as stabbing or burning or deep aching pain. Last, I have inflammation and swelling. Everything I just talked about leads to inflammation and swelling. Inflammation and swelling is often the primary pain generator. This is where your body calls in pain signals so that your brain can constantly be sending healing signals back to this area so that it can start to heal. Your body is really smart. It's just not always the most efficient. However, your body is smart in this way that it is wanting to heal the area. Inflammation is a healing process. It's not necessarily something that's wrong with you. Your body typically is trying to heal something, get rid of something, take care of something, but we don't want more inflammation if we don't need more inflammation. It is just going to create more pain and it's going to maintain pain until that area is taken care of or addressed. The joint is small and it is not designed to swell. So everything I just said, it's great. Your body's so smart. It wants to swell and make this area inflamed and take care of it and start sending healing properties. This area is so small. It was not designed to have healing space. It's just going to put more pressure onto the cartilage, onto the joints itself, onto the small, already irritated fibers. We don't need to create any more compression in and around that pubic bone, especially it's right by that bladder. There's just a lot happening already right in the front of the body, right by the pubic bone. So if we can reduce inflammation, reduce swelling, reduce any of these things so that we don't get to inflammation or swelling, we can for the most part, start to turn down some of this pain. The last thing I'll say is there is a ton of nerve endings. Like I just said, a ton of things happening in this space. All of those things have nerve endings. And you have your labia majora right under your pubic bone, the most neurologically dense place in a female's body. It's going to cause some pain when there's a lot of swelling in and around, pushing on all of those nerve sites. It's just going to be very overstimulating in that area with pain signal. Again, it's not just movement itself that's the problem. It's typically the extra movement that irritates the joints, confuses our muscles, and disrupts the body's ability to stabilize itself. What does SPD feel like? If you haven't felt anything like this and you're like, I wonder what that feels like, because I don't know. Well, a lot of times we don't know what we don't know, so how can we prepare? You can get some nice experience from other moms. And so I have listed down a lot of the common sentences that I hear in the office from women that do have SPD so that you can be aware of what it feels like if one of these is you. So, common descriptions for moms that I get. Lightning crotch, but it lingers all day and all night. A grinding, tearing feeling right in the front. This was putting on pants. I can't lift one leg without yelping. One mom said that she was like, I literally make a sound every time I try to put on pants because it just like twinges. It's a big twinge. Turning in bed feels like my pelvis is going to split in half. That's not normal. That is SPD. It hurts to put on pants, walk, or push a grocery cart. The other one I hear is my legs or my hips feel completely separated when I get in and out of the car. Okay, so these phrases might sound dramatic, but they're so common. They are so common, more common than you think, and they're real. SPD pain is real. It is a real musculoskeletal dysfunction. It is sharp, localized, and deeply unsettling because it affects such a central part of your body and your daily activities and movement patterns. Some moms also experience low back pain or SI joint discomfort as the pelvis continues to compensate. When the pain flares up, typically is rolling over in bed, getting in and out of a car, standing on one leg, putting on pants, going up the stairs. Prolonged walking or standing or lifting, like think about, again, heavy boxes. Even with minimal activity, SPD does not always correlate with doing too much. It can happen with one movement, one swift little movement. SPD can happen. It doesn't always have to happen after a big long workout or many repetitive motions. It can just happen with one singular motion. Often we mistake different pains in the body for SPD, and that's where I can catch women and be like, I know that sounds like SPD or might feel like SPD or somebody might have told you it's SPD, but that is actually XYZ. And I can show them in the body or with the spine or with our chart why it is that portion of the body and how we're going to take care of it. If you're not sure if the pain or discomfort that you're experiencing is SPD, let's talk about it. If you have sharp, quick pain that is usually off to the side or the lower in your groin. So if you're doing this motion, like bikini line hand motion with blades on your hands, that is round ligament pain. If you have pain that is often more in the back side of your pelvis, not in the front, this is typically SI joint dysfunction. If you have pain located higher in the pelvis, typically felt with active hip flexion or picking your leg up in the front, that is typically hip flexor strain. That can happen super easily, especially if you're sitting down for your job, if you're working at a desk and sitting down often, or sitting in your couch in a very flexed position frequently, and then you stand up really quick or something, this can happen. Last, I have shoots down the leg. Pain or numbness shoots down the leg, often past the knee, sometimes into the foot. It can be tingly, nervy, shooting pain. This is typically sciatica. These often are brought into the office as SPD presenting. People are like, I think I have SPD, and they list one of those sets of symptoms, and I'm like, not quite it, but let's talk about it anyways. So just because you don't have SPD pain doesn't mean these other dysfunctions aren't worth taken care of or having them addressed with some support. All pain is pain, all discomfort is discomfort, so take care of it now so it doesn't turn into something more later on. Next, I want to move into the mind-body connection. So SPD doesn't just affect the body, it does start to affect our mental state and our emotional stress. Fear of movement or further injury, that's a huge one. I have women who have come in with SPD who haven't worked out in 10 weeks. They go to work and they lay in bed because they are so afraid of increasing their pain or feeling that sharp twinge or that pinch again, so they just don't do a ton of movement. Well, guess what? That fear is going to lead right into labor and birth. If you have fear about getting in and out of your car because of the pain, what do you think your fear state is going to be around sitting or laying in a hospital bed, laying on your side, whatever it is, pushing a baby out? There's probably going to be a lot of fear to not feel that pain, which is going to result in probably more pain, more labor pain, longer labor, and it might even not allow baby to come out that way because your body's so tense and fearful of feeling pain. The fear is a big one. It's a huge driver. If we are fearful because of our bodies, if we are fearful of our bodies because of the way that they feel, we're not walking ourselves into a really healthy, expressive, enlightening birth and labor experience. Guilt or frustration over reduced activity. I also see this one. So for those moms that haven't moved in like 10, 15 weeks because of so much pain in their pelvis, I see a lot of guilt and frustration. That is super normal, but obviously we don't want that to be your new normal. That shouldn't be your new normal. You shouldn't have to feel frustrated, and that is frustrating that you can't move. So let's get you some support. Let's figure out a way to relieve some of this discomfort any way that we can so that we can get you back moving or give you some other things to do where you're not putting pressure on that part of your body, but you're getting motion and movement in your body. It's always worth talking to someone because these feelings do no good for your pregnancy, labor, birth, postpartum experience. Emotional fatigue from constant pain in one place is something that nobody talks about. It is frustrating to have pain somewhere that you can't see. It's just like, I would put this on the same shelf as morning all day sickness in early pregnancy. No one can see it, but it's just constant. It's so frustrating. It's draining all of your energy, your thoughts, space and time that you have that you should be able to spend prepping for a new life to come into your home. If you're like, I'm not sure if I should talk to somebody. I really still can't tell if I have SPD or if this is worth talking to somebody about. Here are some clinical red flags for you to watch for to see if you need to go talk to somebody. While most SPD cases are self-limiting or manageable with care, these are what we typically see. If you hear or feel popping, clicking, shifting in the front of your pelvis, go see somebody. If the pain causes mobility loss, inability to walk, or falling, go see somebody. If pain is paired with numbness, tingling, bladder, or bowel issues, go see somebody. These issues suggest possible pubic symphysis diastasis or other pelvic pathology and need evaluation ASAP. If any of these are happening, we really do need to be talking to someone to make sure that SPD hasn't now turned into pubic symphysis diastasis, which we're going to talk about. You've heard me talk about diastasis recti. Diastasis means separation or splitting apart. Recti means rectus abdominis, so separation of the abdominal muscles. Pubic symphysis diastasis, separation of the pubic symphysis. Like we've said, there is a normal amount of separation or stretch that there can be in the pubic symphysis. On the very, very, very far end of SPD, it's 9 millimeters. If it goes beyond 9 millimeters to 10 millimeters of mobility space separation, that is considered a total separation of the pubic bones or of the pubic symphysis, and that is what is considered pubic symphysis diastasis. 10 millimeters is 1 centimeter, which again, I know probably seems really small, but for a body that's only expecting half a centimeter for pregnancy to be at a full centimeter of motion and movement in that space, that's a lot of motion and movement in that space. That creates a lot of pain, a lot of discomfort. This also can sometimes happen during delivery if baby is pulled out too aggressively. I think I'm about to get into that right now. Yeah, what causes diastasis or pubic symphysis diastasis. So this doesn't just like randomly happen. Typically, there is something else that happens that causes the full separation. This typically isn't just something random that you do, but let's talk about it. We have instrument assisted deliveries, so forceps or vacuum. If baby is just about to come out, their head is out, and then we pull them out with forceps or vacuum. A lot of times that's a lot of force to quickly on the mom's body, and it can cause that separation or severe tearing. Okay, you guys, I'm super excited about this new sponsor because it's somebody I've actually been working with for a while now, called The Final Punctuation. It's a female-owned, one-woman editing and proofreading service. Her name is Carrie, and she has completely changed how confident I feel putting my words into the world. She's helped me with everything from my brochures to my doula contracts to small marketing things. And not only is her turnaround time incredible, but she helps you to understand the why behind her edits. She sees things that I would have never caught and somehow keeps your voice intact while making everything stronger, cleaner, and clearer. She works with all kinds of creators, from bloggers, podcasters, to small business owners, marketing folks, and even students. Anyone putting their words out into the world. And if you've ever posted something and noticed a typo after, you know how it feels. One tiny error can totally kill that first impression. In fact, stats show that only one typo can increase bounce rates by up to 85%, and grammar mistakes turn away nearly 60% of readers. And I know what you're thinking about AI. Can it just take care of all my grammar mechanics? AI still struggles with tone, nuance, and accuracy, which is not a great combo if you're trying to earn trust. So if you're writing anything from podcasts to brochures, website copy, marketing materials, let Carrie take a look at it. Visit thefinalpunctuation.com to submit a request for any project, and tell her that you're a Pop Podcast listener for 15% off your first order. That's thefinalpunctuation.com. Now let's get back to the episode. We have rapid second stage of labor, which is the pushing stage. So if that pushing stage happens really fast, we also risk pubic symphysis diastasis. Shoulder dystocia, or pulling during the dystocia maneuvers. If you remember a couple episodes ago when we did baby's role in labor and we were talking through their cardinal movements, all the things that they do to work their way down into the pelvis and then all the way throughout the birth canal, they put their head in, they turn their head, and then their shoulders are supposed to turn. A lot of times when that head turns, it starts to come out because they're crowning at that point. Their shoulders haven't turned. A lot of times providers see that head crowning, and when the head gets out far enough, we don't wait for the shoulders to turn and baby is assisted out. That's where the shoulders aren't in a great spot for mom's hips for the shoulders to come out, or else they would have already come out, right? So if we just let baby do their thing, and again, there are time and place when baby needs assistance coming out, but this is something to keep in mind. Once baby's shoulders, or if baby's shoulders are pulled out, that's going to pull mom's pelvis in a very jarring way, and we're not always sure where baby's shoulders are at that position. And so the separation could be here, it could be here, it could be diagonal pull, like it could be all different sorts of ways, which can do a lot of damage on the pubic symphysis diastasis versus just a very basic straight pull or separation. Then we have prolonged or difficult labor. If baby's in a really funky position for a really long time, if mom's in a funky position, laying, laboring, whatever it is, sometimes if mom has an epidural and she can't feel that she's in a funky position or that baby's in a funky position, can put a lot of stress on the pelvis. Next, I have multiple pregnancies. This can happen if you have 2, 3, 4, 5 babies. Often your body just knows how to create that space further. Sometimes we're now using that space before our body has now learned what the actual boundaries of the space of your pubic symphysis is allowing. And then we go beyond that boundary, either picking up a kid, doing something with toddlers, XYZ, working out, and we cause pubic symphysis diastasis. History of pelvic trauma or instability. If you've already had a serious pelvic injury, surgery, we always run a higher risk of issues or problems like this. And then underlying connective tissue disorders, if you already have other ailments in your body that you know already affect connective tissue in your body, there is a chance for you to start creating some more support for this connective tissue before it doesn't have a ton of support. Again, we don't know what we don't know. So if this is your first pregnancy and you don't know how your body's going to react to the relaxant, the progesterone, all those relaxing hormones, and you already have some sort of connective tissue disorder, it would behoove you to get a pelvic belt or a belly band, something to support some different areas of your body so that as things start to loosen up, you don't completely lose yourself through pain, discomfort, or an injury. Real quick though, if you don't know and you're unaware and you're like, I want to see if I have diastasis of my pubic symphysis, these are some signs that typically tell us that we have actually had separation of the pubic symphysis. So sudden sharp pain at the pubic bone, audible pop or crack during birth, severe difficulty or inability to walk, lift legs, or change position, visible pelvic instability or the feeling of giving out, widening or bulging of the pubic bone area, and sometimes swelling, bruising, and extreme tenderness in the area. All signs of diastasis. When to refer or seek help. If you're postpartum and you can't stand, walk, bear weight, especially with new onset pain in the pubic region, please go see somebody. Something's probably up with your pubic symphysis and it probably needs some support, even if you just need some guidance in a pelvic support band, belly band, some movement, some ways to relax muscles or to support muscles to better support your pubic symphysis. Go see somebody. If the pain is intensely sharp it doesn't respond to body work or position changes, go see somebody. If there's visible pelvic asymmetry or clicking with movement, that's not normal. Go see somebody. If neurological symptoms accompany with pain, numbness, tingling, weakness, go see somebody. If you go see somebody, typically they will want to do imaging, pelvic bracing, physical therapy, or chiropractic rehab. In extremely rare cases, sometimes surgical intervention. The imaging with the x-raying and MRI, that will always happen postpartum. It will always happen postpartum. Some of these other things can help you during pregnancy. So like physical therapy, chiropractic, bracing, go ahead and go talk to somebody so that you can see if those things can help during your pregnancy and you don't have to just sit and suffer and wait till postpartum to get an x-ray to see what has happened to your pubic bone. But postpartum, they'll typically want to do one of those x-rays or MRIs to get a better look at all of the fibers and the actual separation, the actual misalignment, and if there's any other compensating patterns that are now landing in the remainder of your pelvis or your spine. Diastasis of the pubic symphysis is super, super rare, but it is rare. It's painful. And if you've ever had SPD during pregnancy and your pain worsens drastically after birth, trust your instincts and go get evaluated. Postpartum moms are strong, but you do not have to suffer and wait for somebody to offer help. This is something that you can go seek help now and take care of to some degree preventatively from getting worse. Go see someone now. Take care of it now. What makes SPD worse? This is my typical rule of thumb. The more asymmetry, the more aggravation. So the more weight or shift or load shift on just one side of your body, the more aggravated that entire joint is going to be. Again, there's not a ton of motion. So if we're doing single leg movements, lunges, lifting one leg, and balancing to put our pants on or leggings, tights, whatever it is, for a significant amount of time, it can put too much pressure onto that cartilage and that joint. Some movements that can commonly exacerbate SPD: getting in or out of the car by lifting one leg at a time, rolling over in bed without keeping knees together, standing on one leg, going up or down stairs, walking long distances or walking with a waddle, carrying a toddler or heavy bags on one hip, lunges, or deep single leg stretches in prenatal yoga or workout. I'm not saying all these movements to be like, make a list of movements that you can't do for the rest of your pregnancy. These are just ways that commonly aggravate your SPD or commonly aggravate the pubic symphysis just in general, can make it a little bit irritated or sore. So it's nice to be somewhat thoughtful of the movements or the activities that we're doing so we don't increase our pain or create a new pain cycle that we didn't already have. Daily habits that can aggravate SPD: crossing the legs while sitting, typically towards your pelvis, sleeping without support in between your knees, again, slouching on the couch with legs splayed to the side. So if I'm leaning on this side, my legs are both off to the side, puts a lot of pressure on just one side of that joint. Carrying a toddler on the same hip repeatedly. That's a whole toddler's weight just on one side of your hip. That's going to put a lot of pressure on both the top side, but also stretch out that bottom side of the pubic symphysis. It's going to be pretty painful on the opposite standing side hip. Wearing unsupportive shoes or over supportive shoes like Hoka's big, thick running shoes with big, thick arches. When we take those off, your feet don't know how to support themselves because they've been supported by a shoe all day. So then they start to fall or collapse, which then creates fall and collapse in your knees, fall, collapse in your pelvis. Then there's a lot of pressure, pain, discomfort in that pubic symphysis area. And then I have sitting on the floor with asymmetrical positions, one leg tucked under the other, often how I sit in this podcast. So don't watch what I do, listen to what I say. I also have some exercises that tend to make it worse. Again, it's not that you don't have to do these, just be thoughtful. Wide-legged squats, lunges or unilateral step-ups, stretches that pull on the inner thighs, like butterfly pose or frog pose, running or bouncing cardio, and any movement that triggers the pain, even if it seems gentle. Many well-intended prenatal classes include all of these or variations of these multiple different times throughout their class. And it's okay to modify or opt out. Nobody's going to bat an eye. Nobody's going to judge you. Everybody's going to accept you and support you. And honestly, most of the time, if you tell your prenatal yoga teacher what you're experiencing in your body, she will give you really good modifications to help support what you need in your body to feel better and less discomfort. I actually took a class with, not just took a class, we did a whole training with Miss Jessica Fawcett in Longmont, and she's an incredible yoga teacher, doula, and she was one of our classes. I completely forgot that we were even doing a lunge because of the way that she had set us up, the cues that she had given us. I had full support in both of my legs, but I was getting a really great activation of my entire body, and we were doing lunges, but it didn't feel like I was putting more pressure into one side of my pelvis. They both felt really supported. So there are really great ways for prenatal yoga classes to help you modify or support your body postures so that you don't experience more discomfort or start to experience discomfort. Everyday movements that you should be mindful of. So if you don't like prenatal yoga or you don't have time to go, these are other movements that you're probably doing at home that you need to be mindful of. Vacuuming or sweeping, repetitive twisting through the pelvis while pushing and pulling, getting out of bed, crazy. A lot of you guys, I see you guys during my exams, I'll have moms push themselves up off the tables to see how they sit up. And I see some of the most insane, wild sit-ups. Be thoughtful about how you're sitting up. It really should just be a one-arm push-up. If you don't have enough strength in this arm, let's strengthen the upper body because your upper body really should be able to sit you up or push yourself to a seated position on the side of your bed. High step-ups, usually onto a tall curb or into your bathtub or going up a ladder. I hope you're not going up a ladder, but if you are, that can be just like too big of a shift. Standing with weight shifted onto one leg for long periods. So chatting, brushing teeth. I often see this with moms chatting or holding a toddler or infant in a carrier and then just leaning into that one side of the hip. Then I also have kneeling with one leg up. This is something I do in the office every single day. Moms often do this when they're bathing their kids or playing on the ground. Be thoughtful of those everyday movements. I always say also in the summertime is a lot of one-sided movements, raking, gardening, a lot of just one-sided movements. So be thoughtful of your summer activities, that you're not just doing one-sided movements, that you're maybe activating or challenging your ambidextrous side of your brain and trying to get the other side of your body to also do the same activity, just so you can balance out the movement stress and compensation patterns that you might have ignited on your dominant side. Now, I want to go back to that emotional and environmental triggers. Oftentimes, stress or tension can cause you to clench your pelvic floor and glutes, which worsens the discomfort. So, if you're already experiencing SPD, being in environments where you are even more stressed out, tension, or just like labor stress, if you are somebody who does work where you are laboring for your work or for your living, these can cause you to clench your pelvic floor and create even more pain where you're already feeling pain and discomfort. A lot of times, our normal daily stress doesn't lead us to SPD, but when we already have SPD, normal daily life stress increases the SPD pain and discomfort. It's just like when I talk about when we go into labor and birth, if you're laboring and you are in pain, but you are so scared that you're going to feel more pain, that fear is only going to increase the pain that you're feeling in your body, which is then only going to validate the fear that you are worried you were going to feel more pain. Now you're feeling more pain. So now it makes the pain 10 times worse. So let's reel it back. If you're experiencing SPD, you need to start putting yourself into really relaxing, stable, safe environments where you feel comfortable and you're not worried about what you're going to experience, feel, or shift in your body. When you feel safe and confident, your body's going to start to feel more safe and confident, and it's going to be more dominant in that parasympathetic healing state, which is what we need if our body is in some dysfunction, which SPD literally stands for Symphysis Pubis Dysfunction. So also with those environmental things, we have cold weather or chilly environments typically make your muscles tighten or clench up, and then long days on your feet, even baby showers. Sit down. You do not need to be on your feet that whole time. And depending on when you're doing your baby shower, especially if you're doing it at the end, definitely make sure that you have a comfy chair where everybody can come and talk to you. Make sure it's in a spot where you don't feel left or isolated, but where it's welcome for other people to come up and talk to you. Maybe some other chairs so people aren't talking down to you. But I always, always, always recommend for baby showers to sit down. You do not need to be on your feet. You don't need to start SPD on the day of your baby shower just because you wanted to talk to all of your friends, all of your family members, and thank them for coming. Moving on, I have some misconceptions that make it worse just because I hear these often with moms who come in and who have already talked to another practitioner who have maybe said this to them and now it's stuck with them. So just like I'll hear moms say, I just need to stretch more. No. If you needed to stretch more, it's already stretching. If you need to stretch it more, it's going to get close to diastasis, right? So we don't want to stretch more. Stretching without proper stability in the pelvis can often create pelvic instability and severe pain. No pain, no gain. What? No, actually, pain equals negative gain. We are negatively gaining. There's nothing to gain with pain. During pregnancy, pain is not normal. So we need to eliminate as much pain as possible because there's already so much going on in the body that your body needs to focus on instead of focusing on healing pain or helping you to not feel that pain. Pain is not normal. Just because you feel pain does not mean that you are gaining something in your pregnancy. So if you feel pain, go talk to someone because there's nothing to gain from pain in your pregnancy. It will go away after birth. Sometimes, not always. There's a lot of things that I say will go away after birth, and I'll tell moms like, oh, it'll go away right after birth. Don't worry about it. Like swelling in the feet or some tingling in the hands. Typically that goes away right after baby comes out. SPD, not always. Baby just stretch that area even more. That area probably has even more stretch, even more pain sensation, even more stimulated pain receptors because baby just came out. So often that area tends to get worse, and because we just pushed baby out, sometimes moms think it's normal. It's not normal. And because nobody talks about it, just because nobody talks about it doesn't make it normal, but this is not normal. If you feel more or excessive pain after birth in that pubic bone region, talk to somebody. You deserve support and you deserve some care so that you don't feel any more pain. Now that we know what SPD is, what it feels like, what not to do, what else causes it, things to stay away from, all the things, I also want to talk about how to take care of it, how to manage it if you are experiencing some pubic discomfort or if you're experiencing SPD. These are some different body mechanic modifications that you can make today and start to feel a difference in that pain or that discomfort right away. So keeping your knees together when you roll over in bed. You should have a pillow in between your knees. Put a little pressure into the pillow with both of your knees and roll over at the same time. Don't separate your knees and reposition the pillow. You can reposition the pillow once you get to the other side, but create some pressure before you actually roll. Get in and out of the car butt first. Well, get into the car butt first and swing those legs in. When you get out of the car, you're going to put some pressure into that side, wherever your side arm support is. You're going to swing those knees, push those knees together, swing those knees around and get your feet out the door and then like stand up, swim out of the door. That is going to help you not step one foot out and put so much pressure into one side of the joint of your pubic symphysis. Then I have use a step to enter your tub or your bed if available. If you can use some steps to get into your bed or even just like I said, getting into your car butt first, that can be really helpful in not putting so much weight in one leg or shifting those hips so much that all the pressure is on one side of the joint. Then I have sit down and put your shoes and pants on while seated. Put your booty on your bed, pull those pants on, then stand up and pull them all the way up. Same with your shoes. If we're putting all of our weight onto one foot and pulling up or tying a shoe, again, too much pressure on one side of the joint. Stand evenly on both feet. No hip shifting while brushing teeth or cooking. If you've ever seen kids give a little presentation in class and they're going side to side because they're kind of nervous, that is actually a sign of sacral instability and less about nervousness. But because our brain and our sacrums are connected, we could see that instability happen in the sacrum. So that wobbling, that shifting is actually a sign of sacral instability. So if that is more comfortable for you, if you can't just stay in one spot, you probably need to get adjusted. Sleep with support, a pillow in between the knees and under the belly. This is going to allow less pull and tension on your round ligaments, your psoas, all of your abdominal muscles, your external hip rotators, and then your internal thigh muscles as well. These all may sound like small little changes, but they really are going to make a huge change because realistically, you do all of these small things many, 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 many times in your life, many times a day sometimes. So these that will add up and these will start to alleviate that pain, that discomfort, whatever you're experiencing right now. And of course, my chiropractic section. Talked about it a million times. We spend a whole portion of the adjustment on the pubic symphysis. There's so much happening right here that I really make sure that there is no pain, tenderness, discomfort when my moms are getting up off the table. My moms with SPD do experience some of that pain and tenderness when they get off the table because they are still overcoming it. But oftentimes, after working through every adjustment, any accumulated soreness that has come up throughout the week, we can eliminate throughout one adjustment. And since moms get adjusted every single week at our office, we are allowing them to compensate and overcome every single week that pain, discomfort that they feel in their body. And then movement and exercise. I really like to do stability-based movement. If you are not a Move Mom and you're not doing the Move Mom birth and labor prep course through our Move Method app, this is what I would do. I would look up foundation training with Dr. Eric Goodman and look up any of their pregnancy workouts or exercise routines. They do have an app, and I think a lot of their stuff is on YouTube. That is a lot of what I'm teaching my moms through our birth and labor prep course. It is foundational functional movement that is not only going to support your pregnancy, but it's going to support your postpartum. It's going to support your husband if he needs to work on his posture, his movement. It's just really great movement that's not going to put any excess stress on your body. It's movement and functional patterns that your body should have access to no matter what state it's in. As long as you can move your body to some degree, foundation training should be really helpful. It's really going to allow you to focus on deep core, functional movement that supports your spine, your nervous system, and normal functions throughout your body without putting too much stress, muscle building, cardio on to a mom. I also really like to focus on core and glute engagement, and glute engagement meaning rather glute relaxation. Because of the amount of glute activation we have in just daily patterns, sitting at a desk, driving, I like to help moms learn how to release the glutes. The glutes often overclench our butts and overclench where our sacrum has motion for laboring. So if we can get better access to those glutes and understanding how they move, how they activate, it can allow us to relax them when it's time for baby to come out. My ideal dream team body workers for a mom for SPD is prenatal or pelvic floor PT and prenatal chiropractic. So pelvic floor PT, they are going to help with a ton of movements. I have a couple listed here, but I'm not even going to go over those because they do so much more than just those couple movements that I did. Some people think that when you go to the pelvic floor PT that they're just going to help you with some Kegels. They're actually really going to help you start to activate and change how you activate different muscles during different motions and different movements so that you don't feel pain. A lot of times we feel pain in very specific movements because we're doing very specific movements incorrectly. Pelvic floor PT is really going to help you learn how to correctly do those movements or introduce you to some new movements that can help you to relax, activate, integrate different muscles within your pelvic floor so that you can have a more successful labor birth, but also reduce the pain in and around your pubic symphysis. Chiropractor, I've talked about it already. Come see a chiropractor. The alignment alone is going to affect everything upwards and downwards. Your pubic bone is going to affect everything in the back. Everything in the back is going to affect your pubic bone. You need to get adjusted because guess what? Everything's getting affected because everything is growing a baby. Everything is supporting a baby, so everything is going to be moving, getting adjusted, accumulating new stress and pattern. And accumulating new stresses and patterns. So we need to adjust those new stresses and patterns and allow the body to actually accommodate for all of the new stresses, patterns, repetitive motions that are now going to start coming through the body during pregnancy, postpartum, and early motherhood. Some other small things that you can also combine with pelvic floor PT and chiropractic care, prenatal chiropractic care, is pelvic belts or belly bands. A lot of times those can help just create some structure and some boundary around the pelvis so that there isn't just excessive motion or stretching, bending, stepping if you're just not as thoughtful about the movement that you're doing in the body. A lot of times pelvic belts can help you create those new boundaries so that you can be a little bit more aware. KT tape or rock tape. KT tape, I like to say, is more like if you fall and get a cut and then you put a band-aid and the band-aid doesn't really like heal it, but it kind of feels a little bit better because there's just a little protective layering. Or this is a better example. If you are sitting down and you have your partner, your husband come behind you and lift your belly and try to take a little bit of the weight off of your pubic bone, KT tape or rock tape is going to give that little pull sensation. It's not necessarily going to take all the weight off of your pubic bone, but it is going to feel like you have some helping hands in and around your belly and provide a little bit more support off of the pubic bone. And then ice packs on the pubic bone, especially after long days of walking or standing. If there's a lot of swelling happening around the area, because this area is not designed for swelling, ice packs work really well to bring down that swelling, bring down that inflammation. But again, remember, inflammation is a healing process. So the body is trying to heal that area. So this can be a little counterintuitive, but an ice pack really does help that inflammation come down to a much more manageable, comfortable level for the body. So the bigger picture of why support matters at all, I see a lot of women come in I love you all, move moms. You're the best people I've ever met. But I see a lot of moms come in not a great state. They're frustrated, they're distressed, they are unhappy, they're not enjoying their pregnancy, they're fearful of movement. They don't laugh at any of my jokes, whatever it is. I can just tell that they're not themselves. And usually after a couple of adjustments, finding some better support for this type of pain, they're completely different human, completely different attitude, completely different experience or expression of life force. So it is cool to see how much we can change with just a little bit of support for SPD, but it also is a big sign of like, look at how serious SPD can be for these women. It's no joke. It is draining all of their energy, all of their emotional capacity, all of their physical capacity, because it's such an intense pain. It's not just pelvic pain, it is a quality of life issue. SPD doesn't just affect the pubic joint, it impacts how you move, sleep, parent, and exist in your body. When walking is painful, even basic daily tasks feel overwhelming. Moms often feel frustrated, limited, and unseen, especially when they're told it's just a normal pregnancy pain. The lack of mobility can lead to a decreased exercise, poor sleep, mental health strain, and disconnection from pregnancy experience. SPD can truly start to impact your labor and birth experience as well. Like I've said throughout the episode, it can make it harder to find comfortable labor positions. It can limit movement between contractions, which may affect baby's descent. It can contribute to pelvic asymmetry, which may influence baby's position for the progression of labor. It can also cause fear, or more importantly, I would argue, it can cause fear around the opening of the legs, which might interfere with the relaxation or the instinctive movement during labor and birth. SPD is no joke. If you're experiencing this during pregnancy, do not let this lead you into your labor and birth with pain. You have the chance to take care of it now. Even if you're towards the end of your pregnancy and you're like, I don't know if I have enough time to make it feel better. Go see somebody. Go see somebody now. The sooner you see somebody, the higher chance that you can take care of this before labor and birth, and you can have a much better labor and birth experience. So go see someone as soon as possible. If you are dealing with SPD, you are dealing with something real. It is not fake. It is not just a normal pregnancy pain. You deserve care. You deserve to feel supported, and you deserve to feel guided into a more confident feeling and comfortability in your body going into your labor and birth. So I always recommend go see somebody before it's too late, but the sooner you see somebody, the better. So if it starts today, if it starts tomorrow, go see someone, go talk to somebody. If you can't find anybody, reach out to me. I'll try to help you find somebody in around your local area. But our takeaways for this episode are that SPD is real musculoskeletal condition caused by joint irritation and instability. It's not just a normal pregnancy pain. The pubic symphysis is a cartilage-based joint that can become overly mobile and inflamed with uneven load, posture shifts, and hormonal changes. Movement is medicine, but only when it's intentional and most often somewhat symmetrical. There are practical modifications, supportive therapies, and hands-on care that can reduce pain and improve function. You don't have to wait until after birth for relief, and if pain persists postpartum, help is still available. Go see someone, take care of your pubic symphysis, your pelvic discomfort, whatever it is that you're experiencing right now. You do not need to experience it any longer. You deserve to feel good. You deserve to feel comfortable in your pregnancy. If this episode was helpful or insightful in any way, please share with another mama to be, especially if she's experiencing SPD or if she's worried about experiencing SPD in the future. I really think that we don't talk about SPD enough, and people kind of just brush it off as pelvic pain, or other people tell moms that it is not anything to worry about, that it's just normal pregnancy pain and it's brushed off to them. So I want you to all realize that this is real pain and discomfort. It deserves care, it deserves attention, and it deserves support. You all deserve support. So I hope you have a great week. Please like, comment, review, please like, comment, share, leave a review, whatever feels good to you. I'm Dr. Emily, and you've been listening to the Popped Podcast.